Hello, good evening, wonderful, fabulous Facebook community. My name is Dr. Karen Sullivan, and I am with you tonight to give you a sneak peek, a sneak preview into our Friday, August 14th webinar on orthostatic tremor, my new favorite subject. I feel that in a pretty short amount of time, I have scavenged the scientific literature. I have been eavesdropping on many Facebook groups, talking to a lot of people, and I feel so satisfied with the information that I've learned. It's pretty much anything that's out there is now in my brain, and I'm excited to share it with you on Friday. Today and tomorrow are the last days to sign up. We have had dozens and dozens of you sign up already, but we're really excited to get those numbers up because I really want to show that this type of information is something that you all crave and that it is worthy of doctors putting their time into giving you really comprehensive education and validating symptoms that are out there for you. So we usually meet and talk about a variety of brain health topics, always trying to come at it from an evidence-based perspective, always a very person-centered orientation. And that is exactly what you will find in my webinar on Friday. So for those of you who are signed up, you can send me some hearts or give me a nice big clap here on Facebook. And that means so much to me. I appreciate your faith that it would be money well spent. For those of you who maybe haven't heard about it or are maybe just learning about it, I'm really excited tonight to go through it with you all. So I still have work to do because I'm one of those people who it's never quite perfect and enough. So I'm going and going and going. So I will be spending all day tomorrow, but probably I'm going to estimate between 130 and 150 hours on this project. And really it's because that's what you all deserve. I have grown so fond of this orthostatic tremor community in such a short amount of time. And part of it is the lack of attention you all have received to date. Most movement disorders are very validated in that it's not just a movement disorder, that it has cognitive symptoms and there are emotional symptoms. I could tell you right now exactly how Parkinson's disease affects people cognitively and emotionally. I could tell you all about essential tremor. I could tell you all about Huntington's disease, multisystem atrophy, progressive supranuclear palsy. It's always a mouthful. I could go on and on and on. And I'm really not quite sure why the scientific community has not caught up with orthostatic tremor as also being worthy of further exploration. Now, I will tell you this. I think that we are on the absolute cusp of this information, and really what I did was kind of preview where I think the field is going to be going in the next 5 years. We are just wrapping our heads around the brain issue that happens in OT, and we really know truthfully about this much, and there's a lot more to learn, but that little bit that we know, which is that it is very much related to something going wrong in the cerebellum. There's a lot I can share with you about the cerebellum. And what I'm so excited to share is that your OT is so much more than trouble standing. It is so much more than a high frequency tremor in your legs. The cerebellum, when it is not working well, does not simply break down in terms of motor symptom or movement. All parts of the brain really work in triplicate. So when you see an issue in the motor system, you are going to see it in the cognitive and the emotional systems as well. Parkinson's is a classic example. So when we think of PD, we think of slowness of movement, difficulty doing things quickly. And that's exactly what we see in the cognitive systems of most people with Parkinson's. There's a slowness in thinking sometimes. There's a slowness in recall. There can be a kind of a flattening, a slowness of the emotion. So it's really like a mirror system that we see in 3 different domains: cognitive, motor, and emotional. But all we've really covered in OT is the motor, and what I'm really finding out from reading is this standing shakiness gets all the attention, but there are gait issues. How you walk is changed in OT. There's just so much that I found out. I'm so excited to share. So what we're going to do right now is I have my 103 slides in front of me and I'm looking at them and we're going to go through and I'm basically going to walk you through it. And really, if you feel like it's something you want to learn more about, then you can go on our website at ICFYB. facebook.com/OT webinar. And we're going to be posting a link as we go through, and you can get more information on how to register. It happens through Zoom, which I have become very comfortable with during this time of telehealth. I see all my patients through Zoom. And if you haven't done it, it's actually very easy to set up. And then you get to just hang out and chill out in your house and listen to me. My time in North Carolina, it's going to be on from 12 to 2 in the afternoon on Friday. Now, I do know you sweet, awesome, beautiful Australian people are getting up at 2 o'clock in the morning to watch me, and that makes me feel really stressed out. But I promise you, as we grow, I'm really thinking of you all because the UK and Australia have always impressed me with their interest in forward-thinking science for the brain. The truth is, you guys are definitely ahead of us here in the US. So what I really want to do as I grow is I'd love to offer things at 2 different times, one that works for y'all in Australia and one that works for people in other parts of the world, because you are all very dedicated to get up at 2. And don't forget, if you can't catch it live, it's yours. I'm going to tell you in a minute how you can access it after. So the name of the webinar is The Many Roles of the Cerebellum, Non-Tremor Symptoms Validated and Explained in Orthostatic Tremor. So the first thing, of course, I have to do in this webinar is I have to tell you all about me, right? Some of you have been following me. I've been on here for about 3 years. But some of you are like, this lady seems nice. She seems interested, but what are her credentials to be doing this? So I am a board certified neuropsychologist. I'm about 1 in 32 in my state in North Carolina. I'm a licensed psychologist. I own a private practice here in Pinehurst, North Carolina. My PhD is from Boston University, and my internship and my postdoc were done at the Boston VA through Harvard Medical School. Before I entered the wonderful world of private practice, where I get to design brain health assessment and intervention exactly the way I want to and the way I think it should be done, I was an assistant professor at the UNC School of Medicine in Chapel Hill, just up the road. But that's kind of my second life. My first life was very different than that. In my first life, I am a high school dropout. I am about a 7 to 8 year caregiver, therapeutic companion, home health aide, nursing assistant, activities director. I've done more bingo and chair exercise than you can possibly imagine, and I loved every minute of it. And that's really what informs the type of doctor that I try to be. I'm very aware of real life and how my words really matter and how support is just so important. And I try very hard to be kind of a hybrid of a doctor, which is, pretty down to earth and accessible, but also I'm very academic in that I love research and I love to keep up with what's going on in the scientific world. So the webinar is going to be 2 hours and I'm not taking a break. We are going right through because it is already packed full of information. We're going to do Q&A at the end, and then in about a day, 2 days, you're going to get an email that's going to have all sorts of fun treats in there and copies of my PowerPoint slides and a link to be able to watch the webinar whenever you want, and it's yours forever. Why I do this is very important. These slides are not like, 5 words and they're going to remind me what to say. This is dense. If you guys took my Essential Tremor webinar, it's a lot, and it's because I respect that if you're taught this information well, there's no reason that you can't learn it. I don't care how much you know about OT or how much medical knowledge you have. My job, I hope you see that here on Facebook, is to explain it in a way that you really get it and it really makes sense. I don't want you dividing your attention while I'm teaching you where you're like, oh God, I gotta write that down, or oh, I really wanna remember that. Everything meaningful that I say is going to be on my slides. You print them out, you keep them forever. I think of it like a library, and you can bring it to your doctor. You can use it for conversation and support groups to meet with other people. I think it's a valuable tool. So the way I'm starting out this whole webinar is asking you a question. Does the description of OT fit your real lived experience? Is it simply a strong feeling of instability when standing, fear of falling, fatigue, and pain? Yeah, I think it's definitely that. But what I'm also convinced of in knowing the part of the brain that's implicated in OT, the cerebellum, and in listening to you all, is I really believe and I know that it's much more than that. So the focus of the webinar is really, well, what else does the cerebellum do and how does that explain the other things that I live through? I'm going to first start off by taking you through a brief history of OT. It's super fascinating from 1970 all the way up to the present day. I actually was able to track down some of the actual test data from 1970, the EMG data, where they actually show you the very first time an OT tremor was captured on imaging. I'm really excited to share that. We're going to go through the genetics. We're going to talk about, does it run in families? Is it sporadic? Are there risk factors? What has actually caused this thing? We're going to talk about who gets OT. Why is it so hard to get this diagnosis? Why does it take so many flippin' years? And why is it that some people are basically told it's stress, it's anxiety? Why do doctors have that in their mind? There's actually a very, very good reason. I'm going to also share with you the gold standard of diagnosis. Exactly what does it take to really be able to count on your diagnosis of OT? I'm going to explain that. We're going to talk about the differences between primary OT, OT plus, which I actually am very opinionated about. And I want to have a conversation with you about some concerns that I have about OT plus. And I have these concerns whenever we come up with the word plus. Essentially, it makes me nervous that we're going to just treat that category like it exists over here and it's never to be touched again. The truth is, when something is plus, Parkinson's plus, essential tremor plus, OT plus, it simply means that a group of people have shown a neurological symptom that probably unifies the diagnosis, but we don't really know how to make sense of it yet. So instead of it being a diagnosis we label and we put over here, we really need to approach it like that's a very curious group that we need to pay attention to. So if you're in the OT plus category, I really want to explain what that means and what you really need to do to advocate for your care. Of course, we need to touch on secondary OT. I want to help you understand how doctors measure if your OT is getting worse, if it's progressing. We're going to talk about the very important question of, is this a progressive neurological condition? It's actually not a very clear answer right now, but my job is to give you smart people the data, the evidence, and you all get to walk with me in my logic and figure out what's a really reasonable way to think about this. I'm going to talk a little bit about what I've concluded after reading all this literature. What really is OT? Is it one disease? Is it a family of diseases? Is it somewhere between PD and ET and OT? All these different acronyms. And my favorite part we're getting into now, which is what the heck is happening in my brain. The literature from 2008 to 2016 started us down a certain road of accepting that the cerebellum was really at the heart of the matter, but it really wasn't until 2016 when we had the first direct evidence of involvement of the cerebellum. And I'm going to walk you through that study. You're going to understand exactly what they found. Now, what's super interesting about the evidence is they did find some evidence of a loss of brain matter, which makes sense when you think of neurological diseases. If something's going wrong, typically it affects brain cells and we get less of them and it shows as a loss. But in OT, it's actually very interesting. We actually have evidence of the opposite. We have evidence that there is more brain matter in certain parts of the brain. And so we really have to use our scientific logic to work backward and figure out why would that be the case. Once you put it all together, that type of neuroplasticity actually makes a lot of sense in OT. So now that we've focused in on the cerebellum, I have to teach you. It's my privilege to teach you. What are the direct results when you have an OT condition? There's things that because the cerebellum is damaged, X, Y, and Z is going to happen. But where we really see the impact is the indirect results. So I'm going to teach you about something relatively complicated, which is the Cerebello-Thalamocortical Loop. And if you can say that 10 times, you're going to win a prize. That is a system in the brain that is multiple hubs, and they are held together by different types of brain cells. And that is how we do something like finding our words, okay? And I'm going to explain that, I think, in really good detail for you. On this hub, this loop connecting the cerebellum, is your limbic system, which is your emotional system, your motor system, which is how you move your body, probably related to the tremor. But very important for our discussion on Friday is that it is related to the prefrontal cortex. And this, my friends, I am convinced is the missing link in your education. If you really understood how something back here can affect something here and what this part of the brain does, nothing wrong with your frontal cortex, but it's on a circuit with the part of your brain that is struggling, you are going to get symptoms. So what I've done in this webinar, I really try hard to make it fun and interesting. I'm actually going to give you 3 different types of cerebellar tests that you can do yourself with me on Friday, by yourself in the future. I'm going to give you cerebellar motor tests, I'm going to give you cerebellar cognitive tests, and I'm going to give you cerebellar emotional tests. And you all get to decide, is this hard for me? Is this not hard for me? OT is very different across different people, but much like what I hope I proved to you this week by asking you to do the M's and the N's, if people continue to say that OT is just trouble standing, why is it so hard for you guys to switch prefrontal cortex job, multitask M, N, M, N, M, N? The way neuropsychological tests work is that we take one little example, something as simple as writing a line of cursive MNs and MNs, and we can say, that shows us the integrity of a certain part of the brain. And that part of the brain, it's not just M and M and M and N. That's where you multitask your checkbook balancing. That is where if the phone rings and the TV's on, you can't really go back and forth between focusing on 2 different things. So my job is to explain to you how I think all of these different indirect disruptions could be affecting you. So we're going to talk a lot about the cerebellum's role in movement. We're going to talk a lot about the cognitive issues. We're really going to focus on word finding. I'm absolutely ecstatic to explain that because I have watched enough videos of OT now to know that oh my, I would bet the farm on the fact that there is bona fide word finding issues in OT, and I'm really excited to validate that for all of you. We're also going to talk about the emotional symptoms that go along with the cerebellar issue, and the main thing is something called emotional regulation. This is so key to talk about because until you know that it may be related to your brain, you know what we all do? We think it's us. We think we're being a jerk. We think we're being a B word. We think we're being impossible and irritable and people don't get us and they wonder why we're so cranky. There is a reason. If your cerebellum is not working properly, when big emotions come on you, you are going to have trouble settling down and getting over it. That is a hardwired thing that our cerebellum helps us do. So I'm going to go through that with you. And what I'm so excited to do is to teach you some strategies for how to deal with it. And I'm really going to focus on the word finding and the emotional kind of intensity issues. We're going to talk about specific strategies that go along with that. We're also going to talk about how OT impacts quality of life. There's been 1 or 2 studies here and there, and it's important work and I want you to know about it, but my God, is there more work to do in this disorder. It's really unbelievable. There's a lot of literature about anxiety related to falling that I want to go over with you all. We're going to talk about the role of stress in OT and how sometimes your symptoms are there and sometimes they're not. How can I walk pretty good sometimes? How can I stand decent sometimes? How can I not other times? I'm going to hopefully try to validate for you the fatigue issue that happens in OT. I have a great slide to show you how hard the cerebellum is working when you are simply standing and literally doing nothing at all. There is a lot of evidence to suggest that the cerebellum can only take but so much input at one time, and after that, we start to see compromise. So I think that's part of what's happening. And so we really have to talk about how is it that we can learn to manage stress a little bit better. I'm also going to talk about drug and non-drug interventions in OT. And the 2 things I'm really excited about there is I want to talk about clonazepam or Klonopin, and I want to talk about gabapentin, because where I came from as a clinical neuropsychologist, when I'm evaluating people and I see in their med list that they take those, I get a little red flag. And it's not a super easy decision, like you either take it or you don't take it. It's complicated. You have to know how to make your own personal individual decisions. But my thing is I want you to be informed to make that risk-benefit ratio yourself and make that decision a partnership with your doctor. I really don't believe in the model of clinical care that is your doctor telling you what to do. I really, really want to empower you to be a full partner in those conversations. I don't think I could talk about drugs in OT if I didn't touch on perampanel and Facompa. I think that's how you say it, Facompa. My goodness, this drug, wow, I really haven't seen anything like it in all of brain science, something that is touted as being this miracle. But unfortunately, when you go to talk to real people, there's some very significant behavioral, psychiatric things, dizziness, gait issues, and falls. So I want to make sure that everyone kind of understands where the science is on that, because really all we're looking at is a couple case studies. And so I've gone through those, and I'm going to explain to you how I make sense of that literature. Then we also have to talk about surgery. Surgery is a final option for folks who don't get enough relief from medications. There's really not great medications for OT. So I'm going to just briefly touch on DBS, deep brain stimulation, and tell you what I think about that. And I'm going to conclude by really trying to put the information I'm going to teach you into practice. And I'm going to try to make the case that we really need to expand the definition of what OT is. It is so much more than I read about in textbooks. It's unbelievable how desperately we need what I call a biopsychosocial model of ET, where it's standard when you go to your neurologist that they say things to you like, how do you feel when you have to stand in front of other people? Have you been avoiding doing things where you have to stand? How is this thing affecting your self-esteem? How can we help you with that? I demand that brain health science evolve in that direction. And that's honestly why I have my own practice, because I get to be the boss and I get to make those decisions that that's the way we're going to take care of people. And I'm doing everything I can to spread the word. I'm going to really try to connect you guys together and help you find your village. I want to talk about ways to really cope with some of the public awareness stuff, encourage you to share your story. We're going to talk about the importance of supporting your organizations, and especially the wonderful doctor at the University of Nebraska. He's such a cool guy. And I'm going to teach you how a neuropsych evaluation maybe will help you, and really encourage you to continue on your learning journey. So like I said, I'm at about 100 some odd slides right now. It'll probably stay that way between a little bit of editing, but it's going to be a lot. It's going to be an intense learning experience, but in my heart, I know that it's my best work, and I'm super excited to share it with you guys. So if you're interested, you can go on our website and learn more about it. What we're going to do is when we send you that email where we give you the slides, we're actually going to add in a couple bonuses, because we were talking last night and we just want to make this so awesome and really encourage people to be with us. So as I go through the slides, when I make recommendations, for example, with the emotional piece, I'm going to talk about the importance of recognizing and identifying your emotions. And there's a tool called the feeling wheel that is something from the 60s, but Carrie, who works with me at I Care for Your Brain, she made it beautiful and made an amazing copy. It is our most downloaded PDF. We're going to include that. We're going to include all sorts of behavior trackers to help you with being more rested in your sleep. We're just basically going to throw in like so many things we've been working on in the last 2 years, just really pile on the bonuses to try to get more people to want to be with us, because we're really trying hard to offer a different way. And I see such a need out there, and I just would be so appreciative for those of you who know me to spread the word and try to encourage people to participate with us, because the more this is successful, the more I can put my time into it and really develop more and more programs, more and more webinars, because I just know you all are not getting this information when you go to your doctor. There's just not enough time. So thank you guys so much for being with me. I always appreciate it so much. You all are such amazing, courageous, funny, smart, awesome people. And I'm just so touched by your messages and being here with me every Wednesday. It just means so much. So I hope to see as many of you as possible on Friday. I'm going to get back to my research and my PowerPoint presentation right now, but I was really excited to take a break and check in with you all. Check out the website to learn even more about the webinar, and I look forward to seeing you guys on Friday. Thank you so much. Bye-bye.